We're very happy to be here today. On the slide, you'll see a little bit of an outline. I'll start by doing some brief introductory remarks to introduce transitions in care and why this is an important topic for us to talk about today. Then we'll hear from Marika talking about a project that we've done here at St. Justine, looking at implementing transition readiness screening in pediatric oncology follow-up care. And then Sarah Umad is going to share about knowledge mobilization resource in terms of transition videos that were created as sort of a offshoot of the project that we're now very excited about. And then, although Ashidi is not presenting today, she's here to also answer questions and is very much the glue that has held a lot of these projects together. And we're very happy to be all working together on this important topic. So just to begin, transition, what is it? Why is it so important? Sorry, I'm moving around the little pictures on my screen. So, over the past several decades, there's been an enormous amount of progress in terms of the medical treatments in pediatric cancer that has led to significant improvement in pediatric cancer survival rates. There are ongoing efforts around the world, literally around the clock, to try and reduce treatment-related toxicity. But as it stands now, there are still risks for late effects related to pediatric cancer and its treatments, and therefore the need to continue monitoring individuals as they progress and age into adulthood. And so now we have this growing, all of that together means that we have this growing populations of individuals that have been diagnosed with pediatric cancer who really would benefit and need this long-term health monitoring and care as adults, and therefore require this move from care in the pediatric system into the adult system. And so, continuing to go to these follow-up appointments as adults is really critical for care optimally aligned with your current needs. Your needs at 26 might be different from your needs at 14. You might have new questions about fertility that weren't there when someone was younger. And so having a provider and be able to answer your current questions is essential. Really critical here for the ongoing monitoring is early identifications and early intervention for symptoms. So catching things when they're smaller, right? And what treatment plans or what interventions can be put in to be able to mediate those instead of waiting for a crisis to appear later on before requiring an intervention that may be more intensive at that point. And then overall better, that's related to better symptom management and a better healthcare experience for individuals overall. And continuing to go to our regular follow-up appointments is really important to get to know your new team and also for your new care teams to be able to get to know you as you progress. And, part of that is also documenting your health history over time, even though that might be no news. And so it's helpful to know, let's say, what's someone's baseline? Is someone's baseline low blood pressure or is it slightly higher blood pressure? Then it's helpful to have that documented in ongoing visits to know if something ever does come up, how that might compare versus someone who might come in more, let's say at a late stage or more of a moment of crisis. So continuing to go to those regular routine follow-ups. And then overall, having a better healthcare experience, being able to identify problems and address them early when they're smaller, that overall increases a better quality of life for people over time. And that's what we want. Unfortunately, and quite alarmingly, many adolescents and young adult childhood cancer survivors discontinue regular follow-up care once they've left the pediatric setting, and there's a steady drop-off over time after treatment completion. So although some late effects might emerge, some late effects might never emerge, and some might emerge years later. And so if we have a drop-off over time, but late effects that increase over time, we can see that there's a mismatch here between the need for follow-up care and the care that individuals might receive. There are lots of different reasons why this happens. I mean, one I've heard often is just, going to adult healthcare appointments is not fun. It's either no news or bad news. So who wants to go to that? So I think it's really important to do a lot of talking and communication about why that might be helpful and what that might look like. So other barriers include that, are well documented and include families being used to the pediatric environment, which is different from an adult environment. Adult environments can be just a lot bigger in terms of patient volumes. It might be different in terms of the focus on the individual, right? Instead of really expecting a young adult to be able to answer questions about their own medical history and not relying on parents for information, expecting young adults to be able to manage their own healthcare appointments and follow up if there are any missed appointments. So there's a lot of responsibility that's put on someone. It also just looks different, right? I love working in a pediatric hospital. There are nice pictures on the wall. There are clowns. There are, lots of friendly things, and that also looks different in an adult environment. So that can be difficult at first too. There are ties that have been created of trust, of people talk about the pediatric teams as a sort of a family with them, and that's hard. It takes time to establish that with a new provider in the adult care setting. I would say this is definitely not all, but for some adult providers, they might be used to working more with older adults, and so they might be less mindful of the experience of youth who come in and may not have all their health history ready and known because their parents for a long time did manage that information for them. And so I think sometimes there's some also improvement to do in terms of adult health care providers and their familiarity with adolescents and young adult survivors and how that experience might differ from someone who is diagnosed as an adult. There can also be cognitive or interpersonal or emotional challenges if someone is anxious, right? That might make it hard to show up for an appointment, or if they're depressed, or if they have post-traumatic stress symptoms, it might be hard to show up again to that healthcare environment in the adult world. So I think those are things to consider. Also, is it hard to get to an appointment? Is there distance, cost, or time? People are saying I have a job now. It's hard for me to take time off my job to go to appointments, etc. And then also service pathways can be more complicated in the pediatric system. Often cardiology is next to endocrinology, is next to an MRI, is next to your oncologist. But in the adult system, sometimes all those different providers can be in different locations, and that can be an extra challenge to navigate. And then finally, what we also hear, and what we've heard a lot in the research that we've done, is that preparing to move to the adult setting is often not a priority. This is a problem for later. I will deal with that when I am 18 or 19, or in the moment where I have to show up in the adult setting. And that is actually tricky because of a lot of the skills that we want to work on early. So thank you for coming today, actually, and learning about this topic with us. So just a little bit of distinction here between transfer and transition. We're going to talk a lot about transition today. Transfer is the moment that someone's medical file will move from a pediatric hospital to an adult hospital or an adult healthcare provider. So that's sort of a discrete moment. And then transition, this is really optimal, is the gradual process over several years in which individuals will develop skills. So the autonomy, responsibility, and skills necessary to take charge of their own health. So these are things like knowing your health history, or being prepared to ask questions to medical providers, or navigate an adult system. And those are things that are recommended to develop early, often starting at the age of 12. Or 14, so that a young adult is ready once they move into the adult setting to be able to manage their care a little bit better and continue adherence to those adult follow-up appointments. Recommendations to support transition from pediatric to adult healthcare settings include routine transition readiness skill assessment. That's something that Marika is going to talk to you about shortly, and I'll share with you a couple of tools related to this. So these are brief questionnaires that can be given, that there are actually, several are available online. So you can also look at these at home if you would like, and but they're also available to use in clinic. And this is being able to screen about whether how autonomous an adolescent or a young might be in terms of managing their medication, their prescriptions, being able to participate in medical sessions with providers. And then the idea would be to screen for autonomy and those different skills, and then be able to set goals to work on over the next year, and then build those skills and comfort with those skills over time. Healthcare settings are also recommended to have a transition care policy or guide. And this is really just sort of flagging that transition is important in our setting, that we care about preparing youth for the adult setting and making sure that they are set up for sort of optimal outcomes in the long term. Talking about transition involving parents, right? So this can be really scary also for parents, this idea that they've really protected, they've really supported their children, they've you know, brought them in for treatments, and then to all of a sudden be told that no, you're not part of this anymore. Now everything falls on the youth. That is really hard. So I think doing that transition gradually of building the autonomy of youth in managing their own care while also having parents as support is really helpful to do while still in the pediatric setting, so that then young adults are more ready to manage their care in the adult setting more independently, but also in the adult setting being aware of parents still wanting to be part of that care plan. Providing a health summary, so a document that really lists your diagnosis, treatment received, often with recommendations for follow-up. There's some really nice work being done by Dr. Paul Nathan and Dr. Sapna Oberoi about Passport for Care in support of this. Then in terms of transfer, making sure that there's a clear provider, that everyone knows what provider or which providers a youth might be transferring to in the adult healthcare system, and then also following up and making sure that the young adult went to their first appointment, right? So that there's no confusion and that adult care thinks that this person is still in the pediatric system and the pediatric system thinks that this person made it to adult care. And then really importantly, I think, is improving access to psychosocial care. We've seen this a lot in the research that we've done, and making sure that in addition to improving skills, we're also improving social and emotional well-being, and that we're also identifying any cognitive late effects that might be impacting navigating the system or navigating resources. I put a bunch of resources in these slides because I know that the time is brief today. Transition Hub is the national Canadian resource website for transition information. Got Transition is an international website that has information for providers on improving transition care, parents, and also youth and young adults. Programme Parachute is our local St. Justine website that has many resources in French available, as well as in English. The Montreal Children's Hospital has developed a really nice transition program as well, with PDF documents and guides and workbooks that can be completed. And then there's information about transitions in care on the Together St. Jude website. There's also some screening readiness tools that I encourage you to look at. Marika is going to be talking about the Transition Readiness Assessment Questionnaire that we use at our center. There's also the Transition Q, and then the Ready, Steady, Go program that's been developed at the NHS. So I encourage you to look at these tools as well. And this is just briefly before Marika talks to you why we're doing screening. We did screening, a big validation study at St. Justine, and we looked at whether youth were actually achieving the skills, the transition readiness skills that we are looking for. And this is the black bar is just those who've really started doing the skill, and these are young adults who are 18 at the moment of transfer. And so we see that many of them have not actually started even practicing some of these skills yet. And that's why we want to screen earlier and intervene earlier, so that we can build some of these skills and some of this awareness a little bit earlier, and so that we're not leaving youth at the age of 18, 19 sort of surprised or having to do a lot of catch up at the last second. I'm going to hand it over to Marika, and I look forward to the discussion.
Okay, so thank you, Leandra. I'm Rika. I'll be presenting the Staying on Track project. So implementing transition readiness screening in pediatric oncology survivorship care. And before starting, Leandra, if you could just change the slide. I want to acknowledge the work of our implementation committee, which was composed of researchers, clinician scientists, but also so many partners, our community organization partners here in Quebec, Le Camp, they're called patient partners, our parent partner, our nurse at the long-term follow-up clinic at Saint-Justine. Her passion, her commitment truly have been essential for the project. And we're so grateful to have worked with the expertise of so many people. And so that brings me to transition readiness screening. Transition readiness screening is a practice Leandra touched on a little bit, but it allows us to monitor transition readiness progress. It allows us to discuss transition explicitly, and it is a practice that's recommended by multiple clinical guidelines for optimal transition care. And there is a questionnaire that exists, the TRAG, the Transition Readiness Assessment Questionnaire. And it evaluates 5 domains. So managing medication, appointment keeping, tracking health issues, talking with providers, and managing daily activities. If you're interested, this is an older version of the track, but there is a more recent version that has less domains and also added questions about motivation and confidence. You can contact me if ever you're interested. But basically, the track exists. It has strong empirical support. It's validated in multiple languages, including French, which is the one we used at Saint-Justine. But only 8% of pediatric oncology centers screen for transition readiness. So that's what really prompted our research team to, you can change it, Leandra, thank you, to previously attempt to integrate the track into clinical care at Saint-Justine. But that previous attempt yielded only 7 screenings before the practice was discontinued for many reasons. But that really highlighted the need for a more structured approach. So that's where we turn to implementation science to really help us structure the integration of the track into the clinic. And to prepare for implementation, we also mobilize key resources. In response to healthcare provider interviews, we found funding for a nurse clinician for her time for screening. We also created a French web resource for transition preparation. And we also conducted focus groups to ensure that implementation was really adapted to the needs of survivors and their parents. And their participation, emphasized the importance of tailored adolescent-friendly education, emotional support, and also really clear communication with the professional about transition and also the track's purpose. If you could change. So that brings us to the webpage that we created. And basically, it was made in response to the barrier of a lack of resources following screening and also a lack of French transition information. So I invite you to scan the QR code to access the webpage, but basically it contains different sections following the track sections. It also links to other resources, and the content was really made in partnership with a patient with lived experience, and it's hosted on the Le Camp website, so our community organization partner. That's very large in Quebec. So our study aim was to monitor and document the process of implementing track screening at the long-term follow-up clinic. So we were looking at implementation reach, the barriers, the facilitators, and the strategies to implementation. And so eligible participants were survivors of pediatric cancer at Saint Justine at the long-term follow-up clinic between 14 and 18 years old. And their parents were also eligible to complete the parent version. And sorry, if you could just go back, Leandra. The idea here was really to discuss and compare results between the parent and the youth. And the nurses were the one that administered the track. And it was really important for them to have at the back of the track a place to write down goals for the year ahead and discuss distress if need be. So we used a small steps approach where the track screening goal on a given month increased by 10% of patients every month, with a screening end goal of at least 70% after 12 months. And we conducted chart reviews every month to see if we reach our screening goal, and also to see who was screened, so their age, their sex, and their diagnosis, to really monitor how representative the patients that were screened were to the overall patients at the clinic. And we also had an implementation committee meeting every month to discuss successes, obstacles encountered, to really be able to adjust to implementation, develop strategies to the different barriers. And so that was an iterative process over 12 months. And for the results, so there were 62 screenings over 235 eligible patients, and 2 nurses did the screening overall. And so you can see here that nurses met implementation goals in December, but it was really difficult to meet implementation goals for many reasons that I will be detailing. Next, please. So overall, as you can see, the screened youth's sociodemographic data was representative of all the eligible youth at the clinic in terms of age, in terms of sex, in terms of diagnosis. So we're really happy about that, because we were really trying to make sure that we weren't a certain diagnosis was falling behind in terms of screening. Next, please. And so now determinants of implementation. So what facilitators, what barriers, what strategies were encountered, developed. In terms of facilitators, our nurse, who was a senior nurse, had a lot of expertise, was really motivated for implementation, and the trust that she was able to build with families and patients was really key for them to be willing to do the track and discuss results of the track. The support from the implementation committee was also a facilitator to implementation. It allowed reflection, adaptation to different strategies, and also the perceived value of the track. Many youth, many parents really appreciated the discussion and defining goals surrounding transition, and to be able to reflect what there's to work on. And now in terms of barriers, so why it was difficult to reach our implementation goals every month. Some items of the track and the response options were unclear, which was a burden for the staff because they had to take more time to explain. And also screening both youth and parents for the first time, explaining what transition is and what the track is for the first time could be time consuming for the staff. And also, as we all know, nurses can be, their workload can be quite high. There was also high patient volume. And so that was a big barrier to screening. And one nurse as well had to leave her position suddenly. So that left only one nurse with a caseload of 2 nurses and the entire load of track screening. So that was also a big barrier that we encountered. Some youth as well had cognitive sequelae, which sometimes required more time for explanation and screening. And also many youth had psychosocial needs and emotional factors that could hinder screening. Sometimes it just was not appropriate to screen because if a youth is not emotionally available, it's not the time. For example, during the transfer appointment, the last appointment, which is really a wrap up, a time to say goodbye, it's often quite emotional. That was a difficult time to talk about screening for the first time. And also if a youth was distressed or needed psychological resources, that really took the space and time during the appointment. And finally, some youth were not motivated to be autonomous because often they were used to their parents taking the lead, and that required more discussion. So what were the strategies that we developed with all these barriers? So we modified the track to make it clearer with the permission of the authors. The response options were reduced to reduce confusion. And the nurse also started explaining the track briefly in the waiting room and letting the youth and parents complete it there instead of completing it during the appointment, which was more time consuming. And she also started only discussing track results with youth only. So her flexibility, her experimentation, that really allowed her to get closer and closer to screening goals despite being alone in her role for multiple months. And she also stopped doing a first screening during transfer appointments. And we also modified the website. We brainstormed as well many resources that the nurse could refer patients to. And that brings me to the Spread Your Wings project. Next slide, please. Which really stemmed from reported needs of youth who wanted resources and testimonials from other survivors who went through transition, and also the need for awareness and autonomy regarding transition. So that prompted us to create videos in partnership with patients who had gone through transition to better assist youth in taking charge of their medical care. So a patient partner also edited these videos. So I'll now hand it over to Sarah, who participated in the videos and really took on the Spread Your Wings project.
Thank you, Marika. And so I'm Sarah, and I will start by first explain my involvement in the project. So I was first a patient partner in Marika's project, where I was part of the videos. So when I was younger, I had leukemia, and I myself had to go through the process of transitioning from pediatrics to adult healthcare. And just as many pediatrics cancer survivor, we expect that once the sickness is done, it is over, it is in the past, and we lock it away. Often we forget that all these years of treatment do have a certain impact on our body, and they are still part of us. And so we still need to go and get checked up. So this project, when I first was part of this project, I first discovered that I was not alone in this process, and that I was not alone in this shock of having to transfer and to still go to appointments. And it was good to know that there's people who are trying to do their best to give more resources, because I was not aware of all these available resources. And so after this first part, we decided to continue this project and to try to disseminate the videos online. And so this is where Spreading Your Wings started. So our project objectives, if we can go to the next slide, yeah. So this project aims to evaluate the dissemination and the impact of these videos. We basically want to know if this content did help, and if it didn't, what should be done better. So we have accumulated, as Malika said in her presentation, all like the screenings, and we try to prepare patients, and we saw that a lot of people were in need of better preparation. And so with these videos, we're hoping to bring that theory to practice and to offer better support and to adapt it to the needs of the population. And so this is more of a knowledge mobilization project, which is defined as in the slide as the active process um, of translating evidence, clinical guidelines, and experiential knowledge into accessible, actionable formats, which in this context, the videos that support decision making for various stakeholders, in this context, the patient survivors. So the way we conducted this project is first by assembling these 4 videos. Originally, we wanted to send them to organizations and have them uh, post it on their own socials, but we realized that that was a little bit more difficult than we anticipated. So therefore, we created our own platform on YouTube and we posted these 4 videos. And we contacted 19 organizations in hopes to have them either share these videos or send their viewers to our own page. So, and then we started an Instagram where we also posted these 4 videos. From the 19 organizations that we have contacted, we received about 7 answers, to which we sent more follow-up emails. 7 answers is, for first, I'm pretty happy about it because we did receive a lot of suggestions to presented, and opportunities to try to share the videos through hashtags and stories on social media. And the way we will take the data, basically, we wanted to do both quantitative and qualitative. The quantitative matrix would be views, shares, comments, likes, hashtags, reach, and all of that. And the number of organizations that do share about our project. And for the qualitative analysis, it will focus on the content of these comments to better understand the viewer perception and engagement. We chose to post these videos on Instagram and YouTube because we observed that we looked for the platforms that had the most monthly users and that correlated with our needs and what we wanted to post. So also there's a little question that I received before when we were doing these, we were trying to publish these videos. It was why contact these organizations, which are technically more for patients with cancer. So these organizations, personally, I'll talk from a personal experience. These organizations are organizations that have been there for us when we were sick and throughout our whole process and our whole journey. So in my opinion, it just makes sense for them to be there also for this part of the journey. They're like a safe space. It's not your doctors, it's not your parents. It's more of a different kind of bond you have with these organizations. For me personally, it was Le Camp, so it does it does make a certain impact, in my opinion, to have these organizations talk about a process like this, and it makes it more relevant for our survivors. And the way we will evaluate these comments, as I said, so we will first classify these comments as supportive to the resource, neutral, critical, or opposing, or complex, depending on the comments that we will eventually receive. And we will apply methods such as the LDA. So for a little summary of what it is, it's basically a way to take themes that are recurrent in the comments and to uh, classify them in better ways in little like sections to have a better idea of the recurrent themes that are present. And as I said, so we are trying to analyze comments, but we have encountered certain limitations, especially in the generation of meaningful comments. We do not have any for the moment. People do interact. We do have likes and views, but it is very hard for people to comment. And we hypothesize that it's because, like, especially on YouTube, you need to have an account. So it's very difficult for people to connect and then put a certain comment. And also, some studies say that rage baiting has more impact in commenting, which we can't really do as our videos and content is more information based. So we are trying to find solutions to that, and therefore this is one of the reasons why we are here today. So what you have to say matters. We want you to watch the videos, share them, comment, like, share your opinion, whether it's good or bad. We videos to be for you, and therefore there's no better way to make them better and make them more pleasant to you than having your comments and your opinions. So I was hoping to maybe have 2 minutes where we watch the video. I don't know if we'll have the time, but I don't know if there's the sound. Does everybody hear or?
Sorry,
Sorry.
did you hear this? Did you hear the sound?
I personally didn't, but I don't know
Oh,
if
yeah, that was my bad. Let me try this again. Is this working? We're really leaving everyone in anticipation.
just for context, this is the first video of the 4 video series.
I'm going to try it one more time.
La transition, c'est le processus de graduellement te préparer à passer des santé pour enfants ou adultes. C'est apprendre à gérer ta santé toi-même, à développer ton autonomie, à poser tes questions, à t'occuper de tes rendez-vous et tes médicaments.
Les suppléments pour voir est-ce que tout est encore correct. On souhaite que oui, mais sinon, on veut savoir le pire.
C'est un changement. Ça veut dire que tu grandis, tu vieillis. Il faut se dire aussi le milieu, ben, c'est pour les enfants. Notre vie, malgré quelque chose d'assez difficile, elle va passer du niveau pédiatrique aux adultes. C'était comme si on m'avait lancé du train avant qu'il ait complètement arrêté.
Ça peut être un choc de devoir transitionner, non seulement ça, mais que tu continuer à vivre avec ça, alors que souvent, on a l'impression que c'est du passé, puis c'est bon, c'est oublié.
Ma psychologue, là, j'étais triste de la laisser. Puis j'aurais oublié qu'on continue à avoir un suivi, mais c'était plus possible. Sinon, ben, mon infirmière pivot aussi, mon oncologue aussi, et au revoir.
Moi, je trouve que c'est vraiment important de se préparer un peu comme un examen. Si tu n'as pas étudié d'avance, ben, le moment où est-ce que tu vas arriver, peut-être que tu vas faire une nuit blanche, étudier à fond, puis au final, ça va juste t'épuiser plus.
Je pense que oui, il y a une attente à connaître l'historique de santé quand vous avez des rendez-vous avec, par exemple, des spécialistes ou de médecins ou professionnels de santé que vous voyez pas régulièrement.
Mais c'est toujours important de aller à ces rendez-vous, de prendre ces rendez-vous et de garder notre santé comme un aspect important de ta vie.
So the QR codes that are there are for our YouTube channel and for the Instagram, but I will share the links also in the chat. And thank you for being here.
Yes, thank you so much, Sarah. Thank you so much, Marika and Algérie and to Access for hosting us today so we can sort of start the conversation together. I think it was hard to say as many things as we wanted to say in one meeting today, but we're really looking forward to the discussion together and to continuing to work on this theme together and to learn from you as well. So with that, I'll maybe open it up for questions.
Yes, thank you all for this amazing talk and highlighting the impact of the work that you showed today. The Q&A is open, so the audience feel free to send in your questions. We have about 8 minutes before the end of the session to get as many questions answered as possible. So one of the first questions we have is, on average or generally, how long does it take one to complete the track questionnaire?
Oh, good question. It's 20 items long, maybe. So I think that can be done in under 10 minutes. But, you know, that's that's variable. It's on one page, so 20 items, and then it's you don't have to writing, it's just check boxes. So I think that helps people do it, complete the form a lot faster.
Great. And one of the questions is there any plan to potentially make these videos in English as well?
Well, for the moment, we have the subtitles in English. This is what we have for now. We maybe hope to have more subtitles. I don't know if Laura has more to say.
Yeah, yes. So that is a good question. I think we're interested in that in our sort of like segue plan of next steps. We had talked about doing videos with parents to talk about their experience of the transition process. So I think that is a next objective for videos for us. And then yes, we can also do them and dub them in English as well. And then we're also very interested in partnering with anyone else who would like to make videos in English throughout this.
Thank you. Um, Another question is, are there any videos or on the difference in the adult versus the pediatric systems and where they can go for tests?
One of our videos does talk about the differences between the adult healthcare system versus the pediatrics healthcare system, from the point of views of these survivor patients. I don't remember exactly which of the videos. I think it's the second one, if I'm not mistaken, but it is in our playlist.
Okay. And then in terms of where to go for aftercare, I think that might be site specific in terms. So I know Calgary has a really great program where I think transition is done sort of in-house, one continuous clinic. There are different models of care that might vary by site.
For here, personally, it's more with my doctor who will guide you towards where to go for your follow-up tests.
The next one is a comment. First of all, thanking you for sharing the video and that they really appreciate hearing and seeing the voices of youth. And for them, it was nice to see how it's struck them when it comes down to the emotional transition to adult care, and that this bond is very strong throughout the cancer journey. So thank you for highlighting this work. Um, um, Another question slash comment is, first of all, thank you. And secondly, have you contacted any of the pediatric hospitals across Canada to share your videos or other materials?
Yes, we have contacted for hospitals. We have contacted more like Children's Hospital Saint Justine, so more here in Montreal. However, for organizations, we went nationwide, so through the entirety of Canada. We hope to contact even more eventually.
I think that's a good suggestion, actually, in our plan, which we hadn't contacted all of the hospitals directly. So thank you so much for whoever suggested that.
And another comment is that in some instances, the pediatric clinic is in the adult center, so that there's really no change between physicians. So it'd be interesting to see if there's a difference in transition between centers where you have to change hospitals rather than those that stay within the same institution. And then the last one is
Just as a highlight, I think Fiona Schulte has done some nice work around that as well.
great, thank you. And another question is, they would like to know how transitions differ between cancer types, or does it seem like it's the same across cancer types?
That is such a good question. I think that might be also sometimes site specific as well. Like I think in Montreal, there's a specific clinic for in the adult healthcare system for specific diagnoses, and there the bridge might be a little bit more established versus others, but I really think that might be variable across institutions.
So some people have indicated that the link is not working. So if after the chat you can share it with us, and then we can make sure that we send it out to the team. And finally, there's another just kind of a share, which is that there are young adult workshops, and at ACCESS, they have parent and young adult workshops that help with like the transferred person led in the healthcare team and members of the adult hospital. So somebody just wanted to share that. And that brings us to the end of questions. If no one else has any questions, we still have a couple minutes.
Hey, I can suggest something. Wouldn't it be great that all we had to do was send it to one email or one social media account, and we knew that everybody collectively across the country is following and sharing so that the onus is not on, this individual who then has to contact all 25 non-for-profits across Canada, across the 145 non-for-profits around the world, plus knowing who are all the media influencers there and all the hospitals. So maybe that is something that we can collectively work on and share all of our social media accounts and everything. So it makes it far more easier for knowledge sharing and exchange.
That's great. So that brings us to the end of the session. We do have a survey that goes out after all of our Access Presents talks. It is shared within the chat, and it will be available online as well. And other than that, I would like to thank all of the speakers today for taking the time to come out and present at our Access Presents and share the work that you have all been doing over the past little while, and really shedding light in terms of where there are needs and where we can improve, as well as progress in the future. So thank you.